Regarding the Yastimadhu being it Madhura Rasa Dravya, often it's used with the Ghrita and often it's used with the Kshira. Yastimadhu Kshira Paka is also there. Should we be concerned about its kapha increasing nature? Should we be avoiding it in like severe kapha dominant people?
No, it is a Pitta Hara as well as a Kapha Hara Dravya. It is not only increases the kapha there, but it expels it out. So that is the reason we use it. And it won't cause any problem in increasing the kapha when it is given with that. But our intentions are very clear. Whenever there is a high dominance of Pitta is there, then such combination with Yastimadhu, Ghruta, Yastimadhu in the form of Kshirapaka, Yastimadhu in the form of powder, if it is given, little bit locally there is an increase in kapha also that will going to suppress the pitta, the ushnata of pitta. So thereby it won't cause you any trouble there.
Because it is having medhya action, meaning improves the brain power, concentration, and all. So I would use this, especially Yastimadhu Ghrita, in case of like a mania or person is highly aggressive, repeated anger episodes, and all associated with say manic depressive psychosis, wherein patient goes up and down with his mood. So it is a very good unique media herb as well, sir.
Definitely, it is one of the important Medhyara explained even by Charaka. Yastimadhu in the form of churna, it is considered as a very good one as a rasayana dravya as well as medhya rasayana. And of course, during even COVID times also we have seen Yastimadhu is doing wonders. We have used in many of the patients with all these symptomatic things, mild viral form of complaints. So in this condition, when we use Yastimadhu, it gives a wonderful result and soothing effect to the body. Of course, it also has a special effect on the brain. The person by afflicting this COVID or something during the period of COVID, something like that, that fear will be also just taken away from him and they will feel comfort by consuming Yastimadhu in that form. In Yastimadhu Kshirapaka, Yastimadhu Kruta, Yastimadhu Ghanavati.
Yes, sir. And one of the things that has been explained even by Master Charaka is it's a Shukrala action. To translate it to English terms, it would be like increasing the sperm count and improving overall semen quality. Very good. You have to use there as well, sir.
Definitely, that's what I said. This is one of the multifaceted drug. That's what my opening statement was. It can be used in all the tissues. It is having effect on rasa, it is having effect on rakta, it is having effect on mamsa, asti, medha, shukra, majja. On all the tissues it has effect. That's the reason it has been included in many groups by Acharya. And it is one of the important pitta hara and kaphavardhaka as well as vrishya dravya. Definitely it will be good even using in sperm related issues and even with the vrishya karma purposes. So it is one of the wonderful drug.
Even sometimes the concept of Vrisha has to be taken in the mental aspect of the patient. Like patient is too much anxious to be successful all the time, or worrying about too much egoistic attitude, worrying about sexual performance. That also increases the anxiety, which would also affect his sexual life. So this should work both on the Shukra Dhatu as well as in his mind. So
definitely it will work on both the lines. It also gives a soothing effect on his brain as well as his performance on the sexual grounds. So it will be fine for both the areas. Single drug acting on both the areas.